Welcome, everyone. Today, we are going to talk about something very important in geriatric care: how to recognize pain in patients who may not be able to tell us they're hurting. This is especially important for elderly patients with dementia, stroke, or other conditions that affect communication. These educational resources are supported by a HRSA grant to UND Dakota Geriatrics, a geriatric workforce enhancement program. By the end of this presentation, you should be able to identify nonverbal signs of pain or discomfort, understand why accurate reporting of symptoms to nursing staff is important, and know how to observe and document pain behaviors using simple tools. Pain is personal, and many older adults can't always say when they're in pain. If we miss the signs, they may suffer silently. That's why CNAs play a key role in observing and reporting symptoms. Let's look at some common nonverbal signs of pain, based on tools like the Abbey Pain Scale and the checklist of nonverbal pain indicators. These nonverbal pain assessment scales include scoring based on various behaviors, including the following: facial expressions of grimacing, frowning, or a clenched jaw; vocalizations such as moaning, groaning, sighing, or even silence; body language clues such as guarding, restlessness, or rocking; behavioral changes including irritability, confusion, or withdrawal. Physiological signs may manifest as an increased heart rate or sweating. Even subtle or small changes can be important. If something seems off, it probably is, and you should document your observations and alert nursing staff. When you notice signs of pain, it's important to report them clearly to the nurse. Use simple, specific language. For example, you could report that Mrs. Lee was grimacing and holding her side, or Mr. Johnson has been more restless and rubbing his knee. You don't need to diagnose, just observe and report. Tools like the Abbey Pain Scale help standardize what we see. Here is a scenario for you to consider. Let's say you're helping a resident get dressed. They wince and say, "Ouch," when you lift their arm. What should you do? Observe, document, and report to the nurse. This is a simple but powerful way to ensure they get the care they need. In conclusion, recognizing pain in nonverbal patients is a skill that takes practice. Your careful observation can make a big difference in someone's comfort and quality of life. Pay attention to nonverbal signs of pain, assuring that you accurately report and document any changes. Thank you for your dedication and care.